Well, a blood test, long used to detect ovarian cancer in high-risk women, may function as a screening tool for the lethal illness in healthy women. Doctors use the blood test to check for levels of a protein called CA125 to confirm a diagnosis of ovarian cancer or to monitor the progress of women who are being treated. Now, researchers say the same test given yearly detected ovarian cancer in a study of 4,000 low-risk women. As a result, the test also could be recommended for healthy women as part of their annual health checkup. The full study is published in the journal Cancer. Now, a troubling statistic out of Kenya. A new report from Kenya's Ministry of Health reveals 455,000 women had abortions last year. That's 48 abortions for every 1,000 women, higher than almost any other country in Africa. Most of the procedures took place in unsafe conditions, either outside of medical facilities or without the assistance of trained professionals. As a result, some 120,000 women sought medical treatment for complications from abortions. To discuss the issue of unsafe abortion, we are joined via phone from Accra, Ghana, by Mr. Fred Gbagbo. Fred Gbagbo is Medical Development Manager with Mary Stopes International Ghana. Mr. Gbagbo, welcome to the program.
Thank you.
Now, one statistic indicates that in Ghana, up to 25% of maternal mortality is caused by unsafe abortion. Could you give us a sense of why this is happening?
Thank you very much. This is an unfortunate statistic, and there are various reasons why this is happening. The main reason for which this is happening is because of the limited access to abortion in the country. Generally, people still believe or have the perception that abortion is criminalized or illegal in the country. And so, in addition to the sensitivity or the stigma surrounding abortion in Ghana, people are not proactive to go to places where the services could be provided safely. And so, there is this undercover sort of people looking for abortion, and that has contributed to this high percentage among young people. And like the situation in our country, young people are not that very much empowered to really come out and take decisions relating to their sexual and reproductive health. And so when they are confronted with unwanted pregnancies, they resort to their peers, and the peers most of the time misadvise or misinform them, and that is accounting for these statistics.
Okay, tell us about how Mary Stopes International Ghana is addressing this issue.
Yes, Mary Stopes International Ghana has been quite receptive in addressing the issue, first and foremost by trying to prevent the unwanted pregnancies through promotion of contraception among young people. And in relation to this, various interventions at the community levels have been put in place where young people are educated on their sexual and reproductive rights, the options for contraception, and the general way by which they can prevent unwanted pregnancies. And in the likely event that this thing fails and unwanted pregnancy sets in, they are encouraged to come to our centers of excellence for safe services.
Okay, Mr. Gbagbo, that's all the time we have for today. Thank you so much for joining us.
You're welcome.
And now to Somalia, where hospitals feel the loss after Doctors Without Borders, MSF, quit operations because of attacks on its staff. Maka Farah sits by a bedside at a local hospital in Somalia's capital, Mogadishu. Her grandson is sick and malnourished. She has brought him here for treatment from the Babado refugee camp just outside the city. Recently, the international medical charity Médecins Sans Frontières announced the closure of all its operations in Somalia because of attacks on its staff. Residents like Farah fear that this will place further strain on an already struggling healthcare system.
I came to the hospital with a child suffering from malnutrition, and the hospital could not provide what our child needs, and we cannot afford to buy medicine for our children.
MSF's announcement came about a month after two female Spanish aid workers employed by the organization also known as Doctors Without Borders, were freed by their Somali kidnappers after almost 2 years in captivity. The group's withdrawal hurts. Miriam Mohammed, who comes from the Iran region in the south, says there are no longer medical facilities in her hometown.
My son is suffering from chest pains. We used to have good health care before the agency shut down all their hospitals in the region.
The government is struggling to hold the nation out of 2 decades of conflict. It provides a little in the form of public services like health and education. Dr. Lul Mohammed is head of the pediatric and maternity ward at the Somali hospital.
It will have a great impact because we had a good relationship with MSF, and things will get worse if other international aid agencies don't fill the gap. The Somali government has called for MSF to reopen its operations in Somalia.
Government officials expressed concern that MSF's departure will have an adverse effect on the healthcare system in the country. MSF had over 1,500 staff working in a range of sectors.
It's too hard to cope and help all the people who need medical treatment because there is no doubt that the Somali healthcare system cannot afford to fill the gap. It has really affected the healthcare system for the Somali people.
Observers say the withdrawal will have a long-term impact on the Somali health sector. And that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com.